Hello, I'm Dr. Stephen Iacoboni, medical oncologist, hematologist at Good Shepherd Cancer Center. It's nice to be with you again. For those of you who didn't see the first video, just let me recap slightly. We opened the program in January and are seeing lots of patients, although things were slowed down by the lockdown. But we're here and really enjoying setting up a cancer program here in Hermiston. As you may recall, I set up the first regional cancer center in Walla Walla back in 1989, and over 30 years was the medical director of 3 cancer centers in the Inland Northwest. I've done some traveling since then, consulting around the country and also outside of the United States, and felt a calling to return back to the Inland Northwest. And right at that time, by coincidence or providence, you can take your pick, Good Shepherd had decided that they were ready to launch their own cancer center oncology program, and I was looking for exactly that sort of thing here in the area, and we got together and moved forward, and so here I am. Today I want to talk about one aspect of cancer care that I think is very important for residents of Hermiston, Umatilla, and Heppner, Boardman, the surrounding region. And that is, can you get the highest quality of care in a small community hospital for something as complicated as cancer? The answer is yes, and that's the end of the interview. No, the short answer is yes, but now let me back up and explain why some people would be concerned about that question and why I can reassure you that that your concerns, while justified, can be addressed to your satisfaction. A lot of people think that big is better. I've worked at MD Anderson Hospital, which is the largest cancer center in the world. 5,000 beds, 500 doctors, people flying in, often on private jets, from all over the world, not just all over the Western Hemisphere, to get their care there. Because how can you not get the best care at a place that has everything all in one place? With respect to something as complicated and organic as cancer care, big is often not always better. So, for example, if you want to go out and have a meal and enjoy yourself, you can go to one of the chain restaurants that are large, and you get a lot of food for not a lot of money, and that's fine. But for those of you who have gone to super fine gourmet French restaurant, it's usually small. And there's one cook who works very hard to make sure that the veal and the pasta and the salad and everything is fresh and just right, as good as it possibly can be for the handful of people that will show up for dinner that night. Now, cooking is a little bit like being a doctor in the sense that there are recipes for how to treat this or that condition, and there are recipes for how to cook linguine Alfredo. But obviously, not every linguine Alfredo comes out the same, and it all has to do with how you pay attention to the little details and the temperature of the stove and exactly how much salt and other spices to put in. And that attention to detail is labor intensive, and that's what makes the difference. As it turns out, in the world of cancer care, there aren't other drugs or other procedures or other medications available to people in Seattle or Portland that aren't available here. except for those kinds of procedures or medications which are only used in a research setting or in a very rare setting. And when patients are here and they need those procedures or medications, if I were seeing them here, I send them there, because all I care about is you getting the best care. But 99% of the chemotherapy that can be given anywhere in the United States is available here in Hermiston. And in fact, 100% of all the licensed chemotherapy is available here. And the only thing that isn't available are drugs which are experimental, meaning we don't know if they even work. And so, while clinical trial involvement and taking experimental drugs is part of what goes on at a research center, the goal of that work is research, not patient care. Now, they do everything they can for patient care, but it's not as patient-centered, it's research-centered, and that's fine. That's the only way medical progress can be made, and that's their mission. Our mission is different. Our mission is you. Every single patient is a statistic of one, and every single patient is going to see one oncologist wherever they go, and that one oncologist, whether it's the only oncologist in Hermiston, namely me, or if you go to Seattle where there are 50 oncologists in a clinic, you're only going to see that one oncologist. And in fact, if you go to Mayo or MD Anderson or a lot of those places, you'll see a nurse practitioner more often than you'll see a medical oncologist. And that's fine. That's their business model. That's their practice model. We don't do that here, because every single time you come in, you'll see me as the medical oncologist. Now, the main thing that matters is attention to detail, just like cooking something or a garden or anything organic that you can think of. It's not the same thing as engineering. Now, it's true that if you use faulty steel or faulty concrete, that your bridge is going to not last as long as it should. But once the specifications are made and the engineers sign off, then the project is just built according to specifications. It's just not nearly that simple in oncology. And what you want more than anything in cancer care is individualized care. All oncology now is reduced to an algorithm. And you can come in and see an oncologist in a major center who signs off on the algorithm, the treatment pathway, and you may not see that doctor again for 3 months. They just sign off and a bunch of stuff happens, and you get chemo on day 1, and you get blood on day 10, you get supportive care on day 15, and you come back for your next cycle of chemo at the 3-week mark. And you may see the nurse practitioner from time to time in there. The nurses will triage whatever issues are coming up, and you may or may not even see a doctor. That's, I don't think, optimal care. I'm not saying that our care is superior. I'm just saying that it's by far not inferior in the slightest, and that's the whole point, isn't it? I've been practicing for 40 years. I have sat face-to-face with a patient upwards of 160,000 times. That's a lot. It amazes even myself. And that kind of experience can't be reduced to an algorithm, and it can't be recreated in a 3-year training program. The only thing that really matters is whether or not the person who is your doctor cares about you. And I said it in my last interview, and I'll say it again. You may notice a little bit of gray, a few wrinkles. I'm not here for any reason other than the fact that I love doing what I do. God has given me the power to heal, and I will do it for as long as He allows me to do it. So I hope that when you're thinking about your choices for cancer care, that you'll think about us. Thank you. It's been great seeing you again.